Hi, this is Dr. Rob Kiltz, CMI Fertility Centers. I'm going to be talking about inflammation, the immune system, blood clotting, and the use of baby aspirin and Lovenox or heparin and how it may enhance your ability to build your family. So the big question is Lovenox, which is a blood thinner, and aspirin, baby aspirin, 81 milligrams a day. And these are used as anti-inflammatories and also to reduce blood clotting, which is likely a factor in the miscarriages or failed implantations. We know that the phospholipids, which are the layers of the cell membranes, are critical. And when there's damage to these phospholipids, platelets adhere to them, blood clots occur, and these micro vessels clot off, which reduce the blood supply to the implanting embryo or developing fetus. So by using aspirin 81 milligrams a day, we believe this enhances implantation and fertility. It may be used empirically since we believe the leading cause of infertility is inflammation, and we all know that inflammation leads to platelet adherence and blood clotting and lots of other diseases. So we use baby aspirin pretty much standard across the board for all infertility clients. And then by adding Lovenox, which is heparin-like, which is a blood thinner, usually a more aggressive form in a very low dose, what we call prophylactic dose, usually 30 milligrams of Lovenox or 5,000 units of heparin once or twice a day. We find that those doses are low enough that it doesn't cause bleeding abnormalities in most people, but you shouldn't be taking it just routinely. We typically prescribe them around an embryo transfer, and you can take it basically up to a week prior to the transfer and stay on it. Depending on the history of your infertility or miscarriages or other implantation failures, we're typically recommending it through 10 to 12 weeks of pregnancy. But there are some, because of repetitive losses or later losses, we're recommending the Lovenox and aspirin through 18, 28, even up to 36 weeks of pregnancy. So depending on your history, no previous losses, multiple miscarriages, multiple early failed implantations, I've generally recommended the aspirin and the Lovenox 30 milligrams once a day, sometimes up to twice a day. Again, very limited reasons why we're doing that, but that's the more aggressive approach in order to reduce the blood clotting, reduce the inflammation in the placental bed, in the uterus, which will enhance the blood flow, oxygenation, and other and nutrients that are important to the growing embryos and your growing baby. Antiphospholipid syndrome, which is anticardiolipin positive, is a less common problem, but it's out there. But it's much more prevalent probably than we understand because, again, generalized inflammation due to high carbohydrates or other antigens are going to affect the antiphospholipid antibodies. And there's a whole host of these antibodies that are probably binding to these cell walls in the vasculature, and then other interstitial spaces, and the cytoplasmic and the nuclear membranes, and then also the mitochondrial membranes. So the aspirin and the Lovenox are used to reduce the inflammation, reduce the platelet aggregation and thrombosis that causes the diminished blood flow. It really is important not to just take this as I should be on this, but it's a good question to ask your practitioner whether or not there's some value. We're likely using it much more empirically, and likely many people are using it that maybe don't need it. So you have to be careful because aspirin, some people are allergic to it, and the Lovenox and or heparin has some side effects that you need to make sure you're talking to your practitioner and they're making sure that this is important and you should be home. But again, when it comes to IVF, we're usually using around the time of embryo transfer and for the first 6 to 12 weeks of pregnancy. At See My Fertility, we believe that the immune system is probably the culprit for most idiopathic or unknown causes of infertility, probably related for both the male and the female. And since we're talking so much more about using aspirin to prevent heart disease and strokes, it maybe should be in the water. But again, you need to be careful before you're just taking a drug without talking to someone more about it. Hope this has been helpful. This is Dr. Rob Kiltz at See My Fertility Centers, where we believe affordability, quality care, and science come together to help you in building your family. God bless. Enjoy this day.